Okay, so question one. You're a freelance interpreter who has just accepted an ongoing assignment interpreting a newly established outpatient mental health clinic. The type of situation includes one-on-one counseling sessions, small group sessions of no more than a dozen participants, occasional large group sessions with an invited speaker. All these sessions will be conducted by a therapist who cannot sign. You have been told that typically you will have a colleague working with you for the small and large group sessions, but for the one-on-one sessions, you will work alone. You arrived early for the first session, a one-on-one session. The therapist happens to meet you in the hallway and you begin talking. The therapist tells you that the deaf patient has called and left a message that it will be about 30 minutes late. The therapist asks how you became interested in sign language and deaf people, so you tell them your story. Then the therapist asks you about residential experience of deaf people and about an article that they read which claimed that there is a high level of sexual abuse of students in residential schools for the deaf. About residential experience of deaf people and about an article that he read which claims there is a high level of sexual abuse of students in residential schools for deaf students. What do you do and why? Okay. Okay, so it's still recording. Um, okay. So I think you'd want to kind of keep it short and sweet. Um, because I don't know, it'd be a sensitive topic and you don't know the reason why the person isn't in therapy at the moment, or the deaf client is, or who the deaf client's experiences have been, or if it is a sexual assault case, or really anything. So probably want to keep it short and sweet and stay professional. Um, Mostly for respect for consumers, because you don't know if the consumer has is going to see the therapist for sexual assault, or if their stuff has been a sexual assault, so they don't want to like add on to the therapist like beliefs that it's just from their residential schools. And I don't think it's like professional, so like engaging in professional like business practice. Um, yeah, it's not. What is it under? Yeah, professionalism. Um, Professionalism 2.5, refrain from providing counsel, advice, or personal opinions. So um, I feel like that could impact both the deaf consumer and the hearing consumer. Because if you're giving your um, opinion, whether or not you have um, knowledge about it or not, it could impact how the hearing consumer can view the deaf consumer and how they would give therapy. And if they just solely put it all on, because the deaf consumer be going to therapy on a sexual assault that could have happened somewhere else, but he could have connected it to, yeah, it just, yeah. So I'd keep it be like, I would just give like a summary of, yeah, because then that could lead you to, it could affect you as the interpreter too, because it could lead you down a rabbit hole of talking about sexual abuse cases in the deaf world and on for a good like 30 minutes before the deaf consumer comes. Um, so I would just give a certain suite of sexual assault could happen like all over the place, and it's really sad that it occurs, and then try to move on to something more small talk wise, kind of keep it, you know, nothing too heavy, nothing that you're maintaining the code of professional conduct and not really giving any opinions or advice or anything, just kind of keeping it on the small talk. So then that'll just, then you won't have the deaf consumer walking in on anything too heavy or too triggering. And then as the hearing consumer, he's not having this heaviness affect his therapy session. And then I'm not 100% sure of how it would affect the agency. Maybe if you gave your opinion and it turned out to be wrong, then he could have report to the agency or something. But then short term, it could help ease the situation and make it very short and sweet. You didn't give any opinions that could sway their vote either way, and it could just be like, oh, okay, and both of you won't be put in that awkward situation and won't have to go down that heavy topic. Long-term effects won't have, your opinions won't help sway the hearing consumers' mind either way on that thing. So, I need to write that down. Okay. Let me copy and paste. Let me copy and paste the. Providing counsel advice or personal opinions. And fix all my spelling errors. because the client could even have sexual assault and their family too. Double check that this is still recording. Yeah, sweet. Okay, question 2. After you respond, the therapist tells you that the reason he asked is a deaf patient is in the session. Yes, has a history of sexual or child sexual abuse, and this is the first of 5 series in a court-ordered therapy session. Deaf person finally arrives, and it is someone you recognize. Oh my god. From interpreting you have done in the community, the therapist directs the deaf person to his office, and the session begins. At the end of the hour, you accompany the deaf person to the receptionist desk to schedule the next appointment. In the middle of trying to find a workable time, the therapist approaches you in front of the deaf person and asks if he can speak to you private for a few minutes. What do you do and why? Yeah, that is why you wouldn't say anything, because then if the deaf person from the last question that walked in on you doing that, he could think the therapist was trying to talk to you about his case and everything, which would result in a lack of trust for the deaf consumer to you if the therapist is sitting there and you guys are discussing his potentially sexual assault, especially if you worked with him before. In this case, I would not go and speak alone to the therapist, because why would the therapist have anything to say to me? I'm there to convey communication between two consumers. So following the respect for consumers and respecting my deaf consumer of not going to speak alone to the therapist, because I'm not there to talk to him. He's there to talk to his client, and I'm just there to have them communicate the stuff. And I don't need the deaf consumer to think that I'm sitting there talking to him, because I can't imagine what he would need to talk to me about. So following the tenet of respect for consumers, of not going and having a little one-on-one, because I imagine that happening if I was in the deaf consumer's place, of just like questioning why they would need to talk to the interpreter when I'm the client. Wouldn't make a whole bunch of sense to me. Trying to find where exactly. Yeah, just a 4.4 of facilitate communication, access, and equality, support the full interaction and independence of the consumers. And I feel like it'd be kind of taking away their independence if you're going and talking to the therapist by themselves, or even yeah, not colleagues. Yeah, because I feel like that'd be kind of sketchy if you just kind of walked in, or just go in. And yeah, even with conduct, avoid performing dual or conflicting roles, because he's probably going to ask for your opinion or something. So I feel like it would just conflict with that. So yeah. Probably kindly say, do the whole nice little dodge of, unfortunately, I don't have time. I have another job, and then bounce. Because I feel like, well, even going back, because if you went with the therapist talk, the deaf consumer might distrust you more, because he'd be like, why are you going off to talk to the therapist one-on-one? What could you possibly have anything to say? The hearing consumer, depending on what they have to ask you, which is probably an opinion or something, would then think that that that's okay to do, might think lesser of the deaf person, that or that it's okay to do to all deaf people, so it could impact how they see the deaf community. For interpreters, it might really smudge that line of what, like that interpreter line, a lot for you of what's right and wrong. And then for the agency and all other interpreters, the hearing consumer might put them in that position for the next job. If you're not the ongoing interpreter, or if he has another client, deaf client, he might do that again. So like long term, it could affect all the other interpreters who might have to work with him, where he's like, let's talk about this person, or can you come with me? And they might be put in that awkward situation. And that might blur the line for you long term. Oh, I thought that was okay. It might, yeah, so it'd really be that wise. Under specifically 3.3. Next. Alrighty. A few weeks later, the deaf person is scheduled to join an ongoing group therapy session, and you've been asked to interpret. You've been told that the group consists of the therapist plus approximately 12 men who are undergoing court-ordered treatments for sexual abuse of children. The group has been in a session for a few months, and it is common for new people to join the group as others leave it. You have arranged for a colleague to interpret with you. You suspect this will be a little more demanding than a one-on-one counseling session. About 30 minutes before the session is to begin, you receive a page from a colleague saying that she's involved in a car accident and has only suffered minor injuries but has been taken to the hospital for x-rays. As a precautionary measure, thus she will be able to interpret the group counseling session. She has placed a call for a referral agency, but they have not been able to locate a replacement. You two contact the agency and they confirm no one is available on short notice. What do you do? They say this is how far in advance? 30 minutes before the session. I would go to the session, just because like it's still my job, but then convey to the deaf person that unfortunately I'd be the only one. And if they would like to reschedule, because they'd still need access to communication, and if they'd like to reschedule, that'd be fine, or I could attempt to do it by myself, but just know that it won't be the best, that might not be the best interpretation. Trying to find where it would be. Yeah, under business practices, 6.4, inform appropriate parties in a timely manner when delayed and unable to fulfill assignments. I would count that as like letting them know that there's going to be like a shift. And that it will be a more rougher interpretation. If they don't want to change, they could reschedule. If it'd be possible to cancel, but if they still wanted to continue, then it was going to be a little bit more rougher. And also letting the client know that there will be more breaks that need to be taken, and like again promoting conditions that are conducive to effective communication, and inform the parties involved if there are such conditions that do not exist and seek appropriate remedies. Oh, please don't space out and delete all my progress that I just wrote. It did. That more breaks might possibly need to be made if possible. Because I will be working one-on-one. Yeah. So it would affect the deaf consumer and maybe trusting me more that I'm communicating with them. Same with the hearing consumer, and that I'm involving them in the process of explaining what's happening and what's going on, but that I'm still trying my best, which will affect me knowing that I have done my best, both long term and short term, that I've done my best and that this is the best I could do and the situation was tough. It might affect both the deaf and consumer and the hearing consumer long term as well, of just maybe in what happens in the therapy session, that there'll be more that was able to be like communicated, especially with the breaks, than if I just went in there and didn't say anything. I don't know the agency, how it would affect them, because they kind of couldn't find anyone to do this. So